We are the Association for Child and Adolescent Mental Health, or ACAMH for short.
Hello and welcome to the ACAMH podcast series. My name is Matt Kemplin. I'm the Marketing Manager for the Association for Child and Adolescent Mental Health, better known as ACAMH. In today's podcast, we'll be talking to Dr. Jane Gilmour about a new series that we've recently launched on our platform, ACAMH Learn, which is called Inside the Teen Brain. Jane, welcome to the podcast.
And thank you for having me.
So before we talk about the series Inside the Teen Brain, which you have been leading on, let's talk a little bit about yourself. Can you give us a brief bio, please?
Sure. Well, I guess there's a number of different orientations and aspects to my role. So in my role at UCL, I'm co-director of a child development MSc at Great Ormond Street Institute of Child Health. And I have a lot of really interesting opportunities to work with postgraduate students on a variety of child developmental topics. Currently, one of the most interesting aspects of my work is looking at part of a grant. It's an ESRC grant headed up by Emily Medouis at the Institute of Education. And we're looking at the process of change in parenting programs. It's a really fascinating grant and one that I'm really delighted to be part of. In terms of my clinical work, I have always been interested and working with young people who have neurodevelopmental disorders. And of course, if you work in this area, you will know if you work with one neurodevelopmental disorder, it means that you work with a number of co-occurring conditions. So I'm an honorary consultant clinical psychologist at Great Ormond Street Hospital attached to the National Tic Service there. So we work with young people who have tics, Tourette syndrome, autism, OCD, ADHD, and so on. So I've been working with that group with great reward, I have to say, for over 25 years or so, including, of course, many young people who are in their teenage years. And I guess the final aspect of my background is my passion for communicating good quality data that's accessible. So I occasionally get involved in radio broadcasting, podcasting, and I've written books for children, families and teachers, including a co-authorship on books on relationships, communication, and the incredible teenage brain, which I co-authored with Tara Murphy and Bettina Hohnen, which brings us to the teenage brain stage of life.
That's great, Jane. Thank you very much. Let's kick off with a peek inside the teen brain. Can you tell our listeners about the series and where they can access it?
So the series Inside the Teen Brain is aimed at practitioners or academics who are new to the area. So it's an introduction really into the extensive literature on the teenage brain. Actually, before I go any further, it's a real misnomer to talk about the teenage brain, although that's the phrase that's used in the literature, because we're talking about the period of life between puberty and about the age of 25, so well into young adulthood. And the series is an invitation to look at the literature and think about how the literature can be applied and so augment and improve practice or academic activity. So each episode focuses on an aspect of the teenage brain. So that might be the pull towards peer integration, the intensity of emotions, the draw on risk-taking, the need for respect, and so on and so on. And the format of each episode is a 3-step exploration into the teen brain. So we've got what's the background, so what, and now what. I would do a 2-minute introduction into the topic in terms of the literature. I would name check some of the key authors and groups, so if anybody is interested in looking further, they've got a place to start. And then we move to the so what section. And here we think about how we might apply these data into day-to-day clinical or academic work. And we talk to leading CAMHS professionals and give them a platform so they can discuss best practice and we can be inspired by their practice. So we review their work, we talk about their favourite mistake, consider their future plans and so on. And then the final segment of each episode asks, now what? And here we get one low cost but high impact tip. And the aim here is to offer a change that doesn't need funding or a huge organisational change, but still might make a difference to the services that we offer young people. And I have to say, we've had brilliant content so far. I've been inspired. It's changed my practice. And one of the things that we were keen to do is offer some really nice, high quality content with low effort, if you like. So it's delivered whether you want to listen to your content or watch it. So it's on video as well as audio. and you can get it on the ACAM Learn platform. So it's acamlearn.org. ACAM Learn is spelled ACAM for mother, HLEARN.org. And I have to say, just to be clear, I didn't develop this platform, but I'm so pleased to contribute to it, and I use it too. I would describe it as a sort of evidence-based Netflix. So for child and adolescent mental health. So you can search this by keyword, by speaker, by audience type. You could follow a topic developmentally through a period of life. You could think about starting at, introductory level and get more in depth. So it's a really wonderful resource, and it's free. I mean, honestly, I sound like I'm being paid to say this, but I am absolutely not. But it's a wonderful resource. It's really great, and I'm delighted to be contributing to it.
That's great, Jane. Thank you very much. And also thank you very much for the rounding endorsement of ACAM Learn. I couldn't agree more with you, obviously. It's a fantastic resource and we urge people to take a look at it. It's been great working with you on the series, Jane, but can you tell the listeners why we are focusing on the teen brain?
Well, I think my interest really developed as we were writing the book. So the book, The Incredible Teenage Brain, was aimed at parents and teachers. But of course, we were drawing on the scientific literature in the first instance. And I have to say, of all the literatures I have ever reviewed, whether I'm considering this as a parent, by the way, or an academic or a clinician, I think it's one that is particularly useful to know because it points very clearly towards an applied method that will engage the teen brain. So there's an evidence base here about how to communicate with the young people, how to deliver information, and what processes will be more likely to draw them closer to you in terms of communication. And in some ways, this series really reflects what I often do in my teaching role. So obviously decanting literature into a sort of palatable package, hopefully reflecting the debate and the nuance, and then thinking about how it might be applied. How can we use these data to great effect? And so the hope is that whether you are an early career academic or somebody that's just getting into clinical or practitioner training, it will start to invite you to think about methods of delivery, ways of engaging with young people using an evidence-based data set. So I'll give you a couple of examples to sort of bring to life one of the hopes that I hope will result following the content that we're offering. So we know, for example, with young people in the teenage stage of life, that didactic teaching to a teenager is less likely to be effective than facilitated peer-to-peer learning. And yet, in our clinical work, we most often, by default, use a sort of didactic model, if you like, a one-to-one, rather than a peer context. Another example might be for thinking about manualized therapy. Now, of course, manualized therapy we may be using for lots of good evidence-based reasons, but we have to balance that against the idea of over-structured, potentially over-routinized therapy processes with engaging our young people. Why? Well, because we know that young people are more likely to be drawn towards risk and novelty, but we don't really leverage that context with young people who could be on the edge of engaging with services. So for some young people, mixing up how, where and when we offer services could be the way of drawing them closer to us. So in other words, my hope is that we overlay the content, the evidence base from the teenage brain literature, and put that into whatever way you are working to augment the practice, engage young people to a greater extent, and hopefully we'll see better outcomes for young people.
That's fantastic, Jane. Very insightful. Thank you very much. So we're recording this at the beginning of February. We've already released a couple of episodes of Inside the Teen Brain, which, as Jane mentioned, you can access from ACAM Learn, also available as podcasts, obviously. Jane, can you let us know about those ones that we've released and also have a little bit of a sneak preview into the ones that we have got coming up over the coming weeks?
Yes, well, I have to say, this is a joy. Of course, each of these episodes looks, broadly speaking, at one aspect of the teen brain. And in fact, we're hoping to have a roundtable review with all our discussants to date so that we can integrate all aspects from the series into a different case or scenario and so on. But the two episodes that we've released to date look at two different aspects of the teenage brain. Now, the first is called Just Be Yourself. And here we examine identity using NU-based tree of life framework. Now, psychology psychologist, Professor Deborah Christie, talks about different ways to help young people with chronic illnesses describe their identity, figure out their own narrative. How much does their illness define them, who they are, and how they're going to engage with the world? Now, of course, Deborah's expertise is with this group of young people, but she describes this framework, which could be used in a whole variety of settings, because we know that teenagers are going through a period in which they're articulating and exploring their identity. And Deborah's description, it's practical. Of course, it's entertaining. It's Professor Christie. It will be, but it's so thought-provoking. It's a wonderful piece of clinical narrative that will be very useful. Now, the second episode is a really special one. It's an episode on autonomy, and it's called A State of Independence. And specifically here, we're examining the positive effects of using a consultative approach with young people. And our interviewee is a young person called Bella, who was a CAMH service user herself, although now she's at university and moved on to a different phase of life. And I think her discussion is quite something. I think the whole team, actually, as we were listening to it, felt very impressed by this young person. She offers some really interesting, insightful, mature ideas about the experience of being a CAMHS user. And I think anybody who's worked with young people will get something from that episode. But we've a whole host of other episodes to come. Shall I describe those two? So we also, to come, we are using a two-handed approach to think about risk. Now, there is one episode called Risky Business, and that thinks about the positive aspects of risk-taking. So with the expert help of Dominique Thompson, we think about why some people have been labelled generation sensible. So how can we coax these young people into taking good risks and think about new experiences and how that might change their approach to life? And then the other aspect of risk-taking is considered with the wonderful Rosie Meek, who's a psychologist with a special interest in prison and rehabilitation. And we explore the other side of risk, the dangerous risks. And these are the risks that can change a young person's life trajectory. And that episode is called A Second Chance. And it's really rich and thought-provoking. We're thinking about young people who are in the criminal justice system. But of course, the content that we're discussing could apply to any young people on the edge of any system. For example, somebody on the edge of school attendance or not. There are so many gems in that episode, including one of my favourite Now What tips, which involves the power of movement. I will say no more. You'll have to listen to the episode to find out. And then we go overseas to explore the social and emotional life of young people. And this episode is called The Heart of the Matter. And with psychologist Aileen Kennedy Moore from the US, she describes a number of practical tools to think about the emotional life of young people, learning to regulate emotions and how that might relate to developing social relationships. And finally, at the time of recording, we're about to interview Pete Etchells, who's an academic psychologist and author of a great book called Unlocked. And that's an evidence-based and very considered overview of technology. This episode will take a balanced and realistic view, and it will explore the good stuff, the bad and the ugly in terms of tech, teens and screens.
Thanks for that, Jane, and obviously a big shout out to those people that have taken part in the series so far. They've been absolutely fantastic. Earlier on in the conversation, Jane, we talked about aims very briefly, so I'm going to throw it back to you now. What would be your top 3 aims that would come out of this series?
I think the first goal would be, now this sounds very basic, but I think it's a very clear one, just introducing the idea of a young person post-puberty to 25 being in a different stage of brain development. The world is consumed in a different way if you're a young person in the teenage stage of life. So just inviting the awareness that that exists. The second would be a gentle introduction into the literature. And it really is a very brief review in the context of the What's the Background segment of each episode. But I think it's a chance to be introduced to some of the key players in terms of the literature and in terms of the data. I think the final part would be about hearing and thinking about how you can apply data in lots of different ways, no matter what sort of work, academic or clinical work, or whether that what sort of young people support you offer. There is a way to augment your practice if you consider these data. So getting some examples of best practice would hopefully inspire practitioners working with young people. I think the other thing to say about the series, and it's one of the things that I've really enjoyed, is the fact that it is a conversation. Now, of course, there's lots of very high quality content on the ACAM Learn platform, but here we've got an interview, and I think there's something engaging about the to and fro of conversation that allows us still to deliver the high quality content. But I think the to and fro of the language makes it a really engaging listen. I certainly so enjoyed doing them. So I'm hoping that the content will be there with the opportunity to overhear a conversation, if you like, which I think is an engaging one.
Yeah, couldn't agree more. And you mentioned earlier that it was really important for us to make it an accessible series. So there definitely is some takeaways there for all of the ACAM audiences, whether you're a researcher, a clinician, someone that deals with children on a regular basis, be it a teacher, a social worker. But why is it important for clinicians in particular to know about the teen brain?
I mean, there are lots of ways that you could consider this and answer that question, but I think one of the most obvious ones is that given this developmental stage we're considering, so post-puberty to around the age of 25, if we are a clinician supporting a young person in that stage of life, we're much more likely to be dealing with that young person individually rather than the family context. There are exceptions to that, of course. So really being able to understand the literature of the teenage brain, know what the evidence base in terms of, the best ways to engage a young person, one of the ways to light their interest, draw them towards whatever content might be good in terms of, making a good change in their life and so on. So essentially we know from the data there are certain principles, priorities or methods of communication that will land best with somebody in the teenage phase of life. If they're post-puberty, this really is like a leg up to forging a richer therapeutic relationship with the young person in your service.
Thanks for that, Jane. So looking forward, can you tell the listeners where we are going next with the Inside the Teen Brain series?
So one of the wonderful things about this series is that there's a whole gamut of episodes to come. So there's an episode released every 2 weeks. So there's a steady stream of content, and we will complete the 6th episode. And then following that period of time, there will be a roundtable discussion where we're going to invite all of the discussants from series 1 to consider a case or a scenario. And we'll get a second chance to hear how they could embed their practice in a particular setup. And then we are planning our second series, and we're gathering together as we speak a variety of different potential interviewees. So we're really excited to think about the teen brain in even greater depth. And I think we are really interested to get some feedback from those that are consuming the content. So if there's any particular areas and content. In fact, I had one question on LinkedIn, which I thought was really interesting, asking about how competition might sit in the context of the teen brain. And I think there's some wonderful ways to think about that in terms of peer perception, but also in terms of risk-taking and novelty that we could consider. But that was a great opportunity. So we're interested in the various social media platforms are great opportunities to give us feedback, but obviously directly let us know, because we would be very interested in hearing what our consumers, if you like, have got to say and where they would like us to go with it.
That's great, Jane. Thank you so much for your time today. And of course, thank you for leading on the series Inside the Teen Brain. So don't forget, you can watch the Inside the Teen Brain series via the ACAM Learn portal. That's ACAMHLEARN.org. And of course, you can get it as a podcast series.